Let's talk to Jamie. Hello, Jamie. How you doing?
All right, Mike, I shouldn't really be talking to you now, should I? You should be in America. So it's nice to speak to
Yeah,
you, but
well, I
it's
mean, it's
difficult
nice to
to
be
chat.
here on the one hand because I need to hold these bozos to account. So it's good to talk to you. And yes, I should. Well, I should be I should be on my way to America, but never mind. I'll get there. We'll get there. Um,
Yeah, and I think, Mike, this Laura Kuenssberg, I think the job advert will probably be, are you any good at asking the government if we can have more lockdowns? That'll probably be the key, the key part of the criteria for the job, I think.
yes, exactly right. What's your view on how long we should lock down for? That would be the first question at the job interview, right?
Yeah, indeed. And I think, Mike, so I think Cabinet is going to meet this afternoon, I understand. And I'll
Yeah,
go
we're
through a
told
couple of the
2 o'clock.
facts.
We're told, yeah.
Yeah, I'll go through some of the facts that have been kind of all over the place the last few weeks. So Sajid Javid, I think last week was saying we've got 200,000 cases per day based on the modelling that was
Yeah.
being produced at the time. And if you actually break down that modelling, Mike, and you just look at it because they were doubling it every 2 days, by Christmas, everybody in England would have had Omicron.
Yes.
And basically, they've come out the Department of Health now and said that model is no longer valid. Well, to be frank, Mike, it wasn't valid when they came up with it. So what the hell he was doing talking about it? And then just in the last kind of few days, we had Neil Ferguson talking about 5,000 deaths a day from kind of the Omicron variant.
Yes.
So let me just explain how I've done a little blog. I've just retweeted it, so people want to have a look on my Twitter profile for that. But what the numbers basically break down is that so we know how many cases there are in the country, Mike, and then 14 days you tend to get the kind of the peak in deaths from those cases.
Right.
So if you are going to get 5,000 deaths a day, I've worked out that by the end of January you need 1.7 million cases a day.
Right.
Now remember, we're having about 90,000 at the moment, so that's a big jump, 1.7
That is
million.
a big jump.
Yeah, but you don't just go from 90,000 to 1.7 million overnight because it increases kind of exponentially, Mike. What it means is that you would have to have 25 million cases between now and the end of January to get to Ferguson's number. And remember now, Sage numbers that they're debating with the government as well, they've got an upper limit of 6,000 a day. So 25 million cases. And what does that mean? Well, we know, Mike, that people have tests, but some people have COVID and they don't have a test. So 25 million cases. When you actually use some data from ONS, you tend to find that for every, say, 10 cases we find, there's probably about 22, 23 actually out there when they do kind of the surveys.
Right.
So that 25 million cases, Mike, is 56 million infections. Now, we've administered
That's nearly the whole
120.
country, isn't it?
Well, exactly. It's nearly the whole country where we've got 126 vaccinations. And Professor Ferguson saying that we're going to be in a much worse place than we have. And those 56 million infections or 25 million cases, Mike, that's more than double the number of cases between now and the end of January compared to what we've had since last March, when the pandemic started. So, even my 6-year-old with an abacus could come up with better numbers than Neil Ferguson, Mike. And then the thing is, Sage aren't any better.
Well, I think if you got the old, monkeys in a room full of typewriters, they should come up with better outcomes than some of the stuff that Sage have come out with. They've never got anything right. They have never got anything right, have they?
No, so September, Mike, Plan B, if we don't bring Plan B in September, we could have between 2,000 to 7,000 hospitalizations a day. Now, I think they're talking 3,000 this time, aren't they? But so what actually happened in England, this is now, not across the UK. So the upper limit was 7,000. It's remained around 700. It started going up in the last week or so in England, but we are in winter, so it's not surprising. Patients in hospital, still 57% lower than this time last year. So in September, they were warning the government, if you don't bring Plan B in, this is what's going to happen.
Yeah.
What happened? Not what they said. So Richie Sunak, I've read, is questioning some of the modelling. Well, if you just go back to what they've predicted in the past, as you said, why would you believe a single word they're coming up with?
Yeah. And you do wonder what they think they're doing, because they speak as though none of us have got any kind of short-term memory of any kind. I mean, like you said, Sajid Javid starts issuing some ludicrous dictum and then goes, "Oh yeah, well that's all right. That doesn't exist anymore. That was what we thought then." But when they say it at the time, it's not as if it's in any way speculative. It's the facts. We are working with the science. We are working on the science, and we are telling you that we might need to have another lockdown. Sage are telling us we need another lockdown before Christmas. Otherwise, 3,000 people might end up in hospital. Well, they might not end up in hospital. It might not happen.
And if 3,000 people did end up in hospital, Mike, I think obviously per day, it would be a challenge. But like I say, 126 million vaccines. I've been looking, I've been concentrating, as you know, the last 18 months with you, Mike, looking at the UK data. And ironically, the number of patients in Wales and Scotland continues to fall. Even though the Omicron variant's out there's a bit of a lag, but Scotland's at a 3-month low, Wales is at a 3-month low. And in Denmark, where you look at kind of the cases and the hospitalizations there, the kind of the ratio to cases to hospitalizations is the lowest it's ever been. The medics out of South Africa are saying the same thing. It's like we don't believe the foreign scientists. We only believe our own scientists. Yeah. We're all kind of doom and gloom. And the thing is, Mike, if they predict these extreme numbers, and then what happens is kind of nudges and scares the government, oh, we better do something. We don't want to be seen to be killing people. And then if they do bring something in, you can never mark the homework in the first place, Mike, because they'll say, oh, well, you brought restrictions in, so our prediction that it was never going to happen. Then was it because you changed things? So, Mike, bonkers.
And what about this Omicron kind of predictive text, if you like? Because you've got Chris Whitty saying, on the one hand, the thing is that we don't have the data yet, but also we do have some data in South Africa. We're going to ignore that because South Africa doesn't count. It's not the same country. It's got a lot younger of population, summertime, therefore we don't like that data, so we're not going to include it in our modelling. What we can include in our modelling, though, is no data at all because we don't have any.
Mike, and so let's look at the Omicron variant. So they're banking everything on booster. So where are these hospitalizations going to come from if we don't do anything? Because the vulnerable and the elderly, we've got over 80% of the population's already had a booster. I think the ones who haven't had a booster, potentially who could, it's a bit more difficult with staff to get some of the vaccines out to some of the care homes and kind of people at home. So if vast swathes of the most vulnerable in society have already had a booster, and not like in the last few days, we're talking, several weeks ago, then who the hell is going to end up in hospital if we don't lock down? Because to me, what they're kind of saying, Sage, then, is that if we don't have some restrictions, we'll have all these people rocking up in hospital. Well, they're kind of saying then the booster isn't going to work. Yeah. So you can't have it both ways. You can't say boost our way out of this, but then you've already boosted kind of majority of the vulnerable people already. Because who are going to end up in hospital? Because you're not going to see 18, 19, 20-year-olds who haven't had a booster rocking up in hospital, in ICU units. Right. That's very, very rare. So I just can't see how you start looking at all of them.
That's the other thing I was going to ask you about, Jamie. We're told the numbers of people in hospital currently with COVID is somewhere around 6,500 to 7,000. Now, in my view, as I remember it, that's less than were in hospital a couple of months ago when it was riding up around. Do you remember when I had that guy on who was a doctor who claimed that there was 8,000 or so people in ICU with COVID, and it turned out that he got that figure wrong because that was the total figure of COVID patients in hospital in the country. So we were looking at sort of upwards of 8,500 a couple of months ago. If it's now less than 7, then we're surely in a better place than we were then.
We are in a better place than we were a few months ago, Mike, but that doesn't get talked about. It's all about the numbers.
Well, I find that extraordinary.
Yeah, no, the numbers come down, Mike. You never hear Laura Kuenssberg talk about the numbers coming down. But when the numbers start going up, it's, Prime Minister, what are we going to do? Because the number of hospitalizations is going to... Now, the World Health Organization's put a tweet out today, Mike, which I fact-checked and stuck out on Twitter, saying the number of hospitalizations in the UK is going up. Like I say, in England, it's gone up marginally in the last week or so, in London predominantly. Right. Wales is down, Scotland is down. So we're in a much better place than we were a few months ago. We're in a much better place significantly than what we were this time last year. And remember, the schools have closed, Mike. And the schools, you can't deny the schools do have an impact on infections because you bring lots of children together. They're closed now. So you've not got that problem at the moment. So why do you need to go any further than what we currently got? It makes absolute no sense.
Well, I mean,
whatsoever.
There's two things that the schools, it seems to me, contribute to. One is the large number of tests which are being done because schools are still doing an awful lot of testing. And two, an awful lot of infections are coming through the schools because an awful lot of kids get unsymptomatic, non-symptomatic COVID. And, nothing then happens, but they count as a positive test.
Yeah, and this time of year, Mike, we had exactly the same as this time last year. You tend to see cases going up because we're significantly tested more. You get a lot of people told, like students, if you're going to go home for Christmas, take a test. So I think 1.6 million tests we were doing daily at the back end of last week. So that, these are some significant numbers in all of these things. And I think just sit down, common sense. If we've boosted all of these extra vulnerable people, and they're saying the booster's the way out of it, then it makes absolutely no sense. People aren't stupid, Mike, in this country. If I've in the past, if I've gone to, I've very rarely done a COVID test. I did the one where I tested positive with a PCR, and I did a lateral flow test because I was going to visit some kind of elderly friends, and one of them's kind of got cancer. So I thought, well, I'm not going to go there if I have got COVID. Did a test. People are sensible. And you've kind of got Mark Drakeford in Wales now closing nightclubs. He was on yesterday on the BBC politics show in Wales, Mike, saying, and they asked him, what support are you going to give to the workers that you're stopping their wages? Are you going to pay them? And he's like, well, I can't guarantee that. And you just think, he's taking over.
Maybe we should say, well, we can't guarantee your bloody pay either, mate.
Well, yeah, £147,000 a year. I've been saying, Mike, for a while now, that these cabinet ministers across each of the countries, they should, forego their ministerial pay whilst anybody is being restricted from working in the country. So that would mean that Boris would, rather than getting, say, £150,000, £160,000 a year, you'd only get about £90,000.
Yeah, no more free cheese and wine either.
And no more free cheese and wine.
Hop down. There's a perfectly good Tesco's just down the road from Downing Street, where he can go and pick up as much cheese and wine as he likes and pay for it with his own credit card. That's what the rest of us have to do. I've never met such a bunch of freeloading scum in my life. They just don't think they have to pay for anything.
No, and it'll all be on the taxpayer, Mike. So they're talking. What I don't understand, on the 20th of December, and the government can't rule out if they're going to bring any restrictions in before kind of Christmas Day. What are they expecting to happen over the next 5 days? A lot of offices have already broken up or told people to work from home. The schools have closed. Are they expecting people are going to just all start going out with mistletoe and start kissing each other or in all these pubs? I just think it's absolute mental. And it's not just that, Mike. 600,000 people every year die in the UK from all causes. They won't have another Christmas. Some of them didn't get Christmas last year and died this year. And for some people, Christmas with families is a time to come together. That's, we've got to remember now, Mike, we live to live our lives, not live to stay in the house locked up because the government tell us.
No, I couldn't agree with you more. Stay where you are if you would, Jamie. I've got a couple of other things to ask you. We'll be back with you very shortly. Jamie Jenkins, independent statistician, political commentator. Of course, he's based in Wales. We'll find out what the situation is in Wales because they are, of course, bringing in a complete ban on nightclubs, even though they had vaccine passports. Doesn't that supposed to save them? Apparently not. This is Talk Radio.
Talk Radio.
Welcome back to the Independent Republic of Mike Graham right here on Talk Radio. Coming up, of course, Ian Collins here at 1 o'clock. Lots more going on throughout the course of the day and the night, all the way through until Christmas Eve. We'll be here with you and indeed beyond. There'll be people here Christmas Day. There'll be Plank of the Year. There'll be all sorts of mince pies being offered up. No doubt there will be some cheese and wine at some point, but don't worry, it won't be provided by the taxpayer. We certainly won't be charging the taxpayer for any cheese and wine that we have. Because why? Because we're not parasitical pieces of absolute and utter pariahness, for want of a better word, and I'm trying not to swear, as you can imagine. Jamie Jenkins is here with us. Jamie, so Drakeford, right, the man who thought that by putting more restrictions on Wales than England, that would somehow make a difference, has had all of that backfire on him. Does anybody ever ask him why he did it, and doesn't he realise it was a mistake?
So I put kind of a tweet on Friday after he was on BBC Breakfast. I think he was saying about closing the nightclubs, and it was a little bit of a challenge on there. And if you look at him, Mike, you can only visit a nightclub in Wales at the moment if you've got a vaccine pass where you've basically proved that you've had 2 vaccines or a negative lateral flow test. So surely they must be one of the safest places to be because these vaccine passes are bomb-proof, according to the politicians over the last few months. Nope. He's closing them. He was challenged at the briefing on Friday to say, does this mean the failure of the vaccine pass? And his response was that he thinks the vaccine pass has been very effective because it means that it's meant that we've managed to keep places open that would otherwise be closed. And you just think, is this man for real?
And he's now shutting them. Well, then why is he keeping them on and keeping them open?
Indeed, he's just not for real, Mike. It's just, and you talk about you got Plank of the Year coming for Christmas Day. I think he might be well up there.
Sadly, he's I mean, he was mentioned in dispatches, but he didn't actually make. Believe it or not, he didn't actually make the top 20. There's that many planks out there.
Well, I was going to say you probably need a 4-hour show this Christmas.
Well, Mike, I think so. Absolutely right. Well, we missed out on the police college as well. But I mean, it is an extraordinary state of affairs that we find ourselves in. I mean, what's your best guess on what happens between now a new year, and then what will they use as, because they want to lock us down in January. It's a question of what possible evidence they can provide that would let them do that.
Yeah, so I think we will see cases go up, Mike, because this Omicron variant is kind of spreading like wildfire in countries where it's virulent, and cases will go up. But cases isn't the important metric anyway. I put the numbers out each day on my Twitter profile, but it's more about the hospitalizations. But the problem they're going to say is that, well, we don't know how many people are going to end up in hospital. We're looking at the SAGE numbers. And I don't think they'll go absolutely nuts before Christmas. I'd be surprised if they do bring any.
I don't think they will. No, I think they're frightened. I think they're too scared of the backlash.
Yeah, no, I think so. I don't think they'll make any restrictions before Christmas, and they'll do some after. But I think I spoke to you several months ago, Mike, and said that cases may start going up in the winter. The NHS has always had problems in the past when it comes to winter months. Ambulances stuck outside, cancer operations cancelled because they haven't got a lack of beds. And I think the concern for me is that they'll just use these numbers to bring in some kind of new restrictions. I think Richie Sunak's obviously going to have to dip into his pocket to pay for all of this. And
well, you would dip into our pocket to pay for it.
Well, true, exactly. And the thing is, Mike, I wouldn't surprise me. This is the thing that I think is really going to be bizarre, is they will start to say, oh, well, we're going to bring, vaccine passes into pubs to keep them open. Mark Drakeford's talking about bringing in the rule of 6 table service. He said yesterday, Mark Drakeford, and he's going to bring this in. He said, you'll have to wear your mask again as you're walking around the venue, but you won't have to have it on for you when you're having your pint or your meal, because obviously COVID doesn't infect you when you're eating your meal, mate.
No, of course not. No, I mean, it only knows when you're getting up to go to the toilet, and you have to obviously wear it in the toilet.
Yeah, and it's very clever, this COVID, because in Ireland, Mike, they've just brought an 8 p.m. curfew in Republic of Ireland because it only comes out at night. So it's just bonkers. And just final thing on the vaccine passes, Mike, as well. I don't know if you caught the story of the weekend. Germany now have said if you're going from the UK, you have to quarantine for 10 days, even if you've double vaccinated. Yeah. Well, sadly, some people have taken the vaccine. Obviously, people can make their own choice on vaccine, but some people have told me they've taken the vaccine just to go on holidays.
Yeah, right.
And now they're starting to kind of backfire on that, because people can't go on holiday because they've told you, sorry, I don't care if you're vaccinated or not. You got to go and stay in a hotel for 2 weeks.
Yeah, which completely and utterly kind of puts people off getting the booster. This is the bit they don't get, because people are going, well, if you're going to not let me do anything once I've had 2, what makes you think that I should have a 3rd one? Because then you're not going to let me do anything after that either.
Exactly, Mike. And what they're going to do in January is, because we were talking about what might be coming ahead, is it's guaranteed. We've got MPs that I've seen and some ministers saying how many people are in hospital are unvaccinated. What these MPs are now saying is, if you've had 2 doses of the vaccine, they're classing them, some of these, misleading the public by saying, oh, these are unvaccinated. Well, no, if you've had 2 doses of the vaccine, you're not unvaccinated. You've had 2 doses of the vaccine. So manipulating the numbers, they quite clearly are, Mike, in January going to say, if you haven't had a booster, you can't have the vaccine pass. And they removed last week, if you've had prior infection, so natural immunity, from the COVID pass. So Sajid Javid yesterday saying that they think South Africa has done much better because they got a lot more natural immunity from the last variant. What's the response from this government? We remove natural immunity from the COVID pass.
This is it. So they accept that in South Africa you can get natural immunity from a variant by not vaccinating against it. But in this country, they don't accept that.
Now, I think what this virus has exposed, Mike, is just how incompetent the governments across all 4 nations are. Yeah. And I think it's there for us to see now on a daily basis when they're coming out talking about things. And it's just a shocker, Mike. And sadly, thousands of people's lives will be affected again. We know that most of the people who are vulnerable have had a booster. We're not suggesting all of those start going out mixing. How many, pensioners who are vulnerable are in nightclubs? None. Just absolute bonkers, Mike.
Yeah, just Michael Gove, I think you'll find is the only old bloke you'll see in a nightclub anytime soon. Jamie, good to talk to you. Good Christmas. I'm hoping you will have, even in it's in Wales, if we don't speak to you before. Jamie Jenkins there from the formerly ONS, Department of Office for National Statistics, now an independent statistician.